My name is Darcy Mercereau. I run the health program out of Washington, D.C. for the world. And my job today is to set the stage a little bit, because you're going to go after this into a smaller group that's just health promotion, or it's just healthy hearing or fun fitness. And you're going to really immerse yourselves in that. And so my job before you go there is to give you a little bit of a broader context, some history about Special Olympics overall, some history about why we started doing health and why we do health in Special Olympics, and then set you free. This is a picture from the very beginning, the origins of Special Olympics, which is Eunice Kennedy Shriver's backyard in 1962. Eunice Kennedy Shriver was the sister of President Kennedy. She was also the sister of Rosemary Kennedy, who had an intellectual disability. And even though the Kennedy family was unusually well-resourced compared to most families of people with intellectual disabilities, they still had a very Rosemary had a very sheltered life. She wasn't engaged in the community. She wasn't engaged in the same kind of opportunities that other children and young adults growing up had access to. And at the same time, the Kennedys had other people that they knew who had family members with intellectual disability who similarly felt excluded. And this was an era where a lot of people with intellectual disability lived in institutions. And so there really wasn't a lot of participation. And so I think at some point Mrs. Shriver just had had enough, and so she invited everybody to her house for something that she called Camp Shriver in her backyard, and it was a summer sports camp. And she picked sports, I think not only because the Kennedy family really loved sports, but because she felt there are a lot of places where people with intellectual disabilities are excluded and maybe don't feel like they can achieve or succeed. But the playing field is a place where they can. They can show their capabilities and their abilities, not just their abilities. And this is where they come together and experience what everybody experiences, and show off some of their talent. So she started Camp Shriver, and it really did catch on and kind of ballooned out to several other states and was a success. But at some point she started wanting a little bit more. And that's because summer camp is summer camp. It's wonderful, but at the end of it you go home and you go back to your life. And it's not a year-round activity. And so she started moving in the direction of a year-round sports program. So this is a picture of the first International Special Olympics Games in 1968 in Chicago. They were international because they had Canada and Ireland participating. So it was a very different organization than what we have today, which is a year-round organization in 170 countries with almost 4 million athletes around the world. A lot of people from the US don't realize what a global organization it is. And then those athletes are surrounded by coaches and volunteers and lots of different people from the community who come together to help create this experience. And it really results in building communities of change. And these days we really talk about Special Olympics as a social change organization. We use sports to show people the value of our athletes, and to let them show people their own value. And I really think of it as a human rights thing. It's through Special Olympics that people have doors opened. There's a little video that I think explains sort of the philosophy about why sport. Why do we do sport in Special Olympics? And it also talks about some of the non-sports programming that we've built around it.
Sport teaches us. When we train, it teaches us to dream. When we struggle, it teaches us determination. When we win, it teaches us joy. And if we lose, sport teaches us the will to try again. Sport teaches us who we really are. Who can benefit most from this lesson? Those of us who are told most frequently that we can't. Those of us who are labeled most often by others. Those of us who are judged most unfairly and told that we are this or that. Sport teaches people who they really are, and we teach people sport. We're Special Olympics. Founded by Eunice Kennedy Shriver in 1968, we provide millions of athletes with intellectual disabilities in more than 170 countries the opportunity to experience all the empowering benefits of sport, with over 44,000 competitions a year and World Games every 2 years. And though it all starts with sports, Special Olympics is much more. We're a network of families who share information, understanding, and support. We're Special Olympics Healthy Athletes, the largest provider of free health services for people with intellectual disabilities. We're volunteers and builders of communities, reaching and helping people who would otherwise be forgotten in some of the most neglected areas of the world. We're bridge builders, helping to forge relationships and acceptance between our athletes and young people without intellectual disabilities, teaching them to become leaders in their own right. We're champions and advocates for learning, research, and policy changes across the globe. Most importantly, we're also a catalyst for social change. Because once you see what our athletes are capable of, you start to lose your preconceptions. So sport teaches people who they really are, and we teach people sports. But in the end, it's really they who teach us all. Special Olympics. Be a fan.
I think this is the question that a lot of people inside Special Olympics actually asked themselves when we started doing health. And those of you who are from programs may have experienced this, but those of you who are being trained as clinical directors will definitely experience when you go out to recruit people to come and volunteer at Healthy Athletes, they'll say, Special Olympics, don't they do sports? Why are they doing health? And we're not known for health, and so it's a constant education to make people aware that this is an important part of what we are doing. So I want to just tell you a little bit of the history of how we ended up doing health in Special Olympics. The history of health, I think everybody in Special Olympics knew that our athletes' health was not on par with what we would expect in the general population, but there were a couple of doctors who really made a difference and kind of kicked us in the pants and helped us move in this direction. And one of those was Dr. Steve Perlman, who is from Massachusetts, and he was the dentist for Rosemary Kennedy, and he will be here, but he was in Mexico running a different event yesterday, speaking at a different event, and so he flew back yesterday, and he will be here at some point today. I think his experiences with Rosemary and with other patients with intellectual disability made him come to Special Olympics Massachusetts and persuade them to start doing screenings for the athletes in oral health. At the same time, there was a doctor in New Jersey, Paul Berman, optometrist, who started doing vision care screenings at the local level as well. And the two of them persuaded Special Olympics International at the 1995 World Games in New Haven to come and do screenings for all the athletes competing at those games. And we said, okay, sure. And so these World Games athletes traveling from all over the world, they did their competitions, and at the end of their competitions, they came to Healthy Athletes and they got screened. And it was just at that point, eyes and teeth. And what happened was, even though we kind of knew the athlete's health was bad, it wasn't until we took every single one of those screening forms from the event and we put them all together in a database and we looked at the overall numbers that we realized just how bad it was. And I think it was about 18% of the athletes needed urgent referrals for dental problems. Like they needed to go to the emergency room, they were in that much pain. And they had traveled around the world to compete in World Games. They were like the cream of the crop. And 18% of them just needed to go to the hospital. And the other numbers were all just really stunning, and persuaded us that we needed to move from being horrified by this to doing something about it. And we looked around at first and to see who else was doing something. Is this really the place for Special Olympics to be? Can we partner? And realized nobody else was doing much in the area of health for people with intellectual disabilities. The next thing that we did, because we didn't want to reinvent the wheel, we're a nonprofit, we don't have a lot of resources to throw around reinventing wheels, so we commissioned a study from Yale University to look at the literature, to look at what was known about the health of our population of people with intellectual disabilities, and to know, just what was known and what was being done. And so Yale published this report that's like, I don't know, a couple hundred pages, that basically in the end says, really, we don't know that much. And so what we did was, for our 1999 World Games that were up in Alaska, was we got the Senate, the US Senate, to convene a subcommittee hearing of HELP, the Health, Education, Labor, and Pensions Committee in the Senate, and they held a field hearing up at those games. And we presented the data from New Haven, and we presented the study that Yale had done. And the Surgeon General at the time, David Satcher, was there, and he published this report, Closing the Gap. This report has served as a catalyst for a lot of programs and funding and policy work since then. This is used as a justification and has been coming forward. And it came out of those games. The other thing that came out of those games was our first appropriation from the US government to support the growth of healthy athletes around the world. And so it went from a few small screenings done by volunteers to what it is today, which is about 900 events a year. So this is hard to see. These are the logos from each of the healthy athletes disciplines. And there's another little video clip here that just describes and gives you a visual on them, which I think is important because you're going to spend all of your time in Special Smiles. You're going to spend all of your time in Fit Feet. And so I think you can see a little bit in this video of what the other disciplines do.
The heart of healthy athletes is its 7 disciplines. Fit Feet provides athletes with a foundation from the ground up. Fun Fitness offers stretching and physical therapy techniques for long-term health. Health Promotion educates athletes on key issues such as diet, nutrition, hydration, bone health, and sun safety. Healthy Hearing ensures that athletes can hear the sounds from the playing field. MedFest enables more athletes to participate in games and competitions by offering sports physicals. Special Olympics Lions Club's International Opening Eyes conducts thorough vision screenings and provides free eyeglasses. And Special Smiles screens athletes for dental problems and offers preventative care. And it is all free to athletes around the world.
So here are the goals of healthy athletes. The first impression when you walk into healthy athletes is of that doctor. Actually, the first impression will probably be mass chaos, but the second impression, it's ordered chaos. But the second impression will be of that interaction between the doctor and the athlete. And I think that for those of you who are clinicians, that is probably what drives you and what brings you to the table and will keep you involved. At headquarters, we look at it more broadly, and I think you will probably come to as well if you don't already, which is that those encounters are important and really make a difference in the lives of the athletes that you're working with at the time, but they don't necessarily help the wider system. And so we really think of this as a public health program, not only because of what we're doing at the screening event with the athletes, but what we're also doing at the screening event with all the students and health professionals who come there to volunteer. And those folks, you probably know from your own training programs, don't really get training in working with patients with intellectual disabilities, either in the classroom or in clinical side of training, and with the exception of people who have pediatric specialties. And so this really is filling in a gap that exists in their training. And I think not only provides knowledge and skills for working with just a big range of people, but at the heart of it, probably the biggest barrier to overcome is that initial discomfort that most people have when they're meeting somebody who's a little different for the first time. You know, everybody has it, but when you're a doctor and you're trying to get through a health history with somebody, it's hard if you have to deal with the disability first and your own discomfort before you even get to that point, and then your 15 minutes are up. And they're gone. A lot of, I think, the health problems in our athletes are less because of their underlying disability and much more because of other factors, whether it's, there are policy factors and reimbursement in the system, but the fact that our system and our healthcare delivery is not set up to work with people who need a little extra time, people who are nonverbal, maybe people who don't communicate in the same way, or people who we're just not naturally comfortable with instinctively. And so I think, when you go through a healthy athlete's day of volunteering and you see 80 athletes over the course of that day, and they have a range of disabilities, and they have a range of, some of them are verbal and some of them are nonverbal, and some of them, or just have a more mild disability or more severe. By the time you're done, you're just a lot more comfortable working with that population, and I think that's 9/10 of the battle. So to me, one of the most important things we do is provide training to health professionals. And it's really, for those of you who are new trainees, you're going to go out and recruit people who may have never worked with this population before, and students who are at the beginning of their careers who are going to have something that maybe most people don't have at the beginning of their health professional careers. So you're really making a difference in the healthcare profession in your community as well. The other thing that we do is we still, ever since New Haven, collect every single one of those screening forms and put them into a database, which we use, the data that comes out of that we use to talk to policymakers, we use to talk to potential partners who might provide follow-up care for the athletes. We use it for a lot of different purposes, the media, raise awareness just in the public, we use it to raise money. And for those of you who have a university background or affiliation, that data can be very useful from a publishing perspective as well, and so we will work with you if that's something that you're interested in. We've been doing Healthy Athletes officially now since 1997. We hit the 1 million screening mark in 2010. We've done screenings of athletes from over 160 countries or so around the world, and it's pretty exciting stuff. We've trained a lot of healthcare professionals. We've provided free eyeglasses, free hearing aids, free orthotics, just a range of different kinds of care to those athletes, some of whom are coming to the doctor for the first time. That won't be as much the case in the US, but outside of the US it's often the case. I will only show you one data slide because some of you would be really excited if I showed you a few more data slides, and most of you would fall asleep. So, but this is data from our World Games, from our last 4 World Games, because they're big events and we completely control them, so these are the data that we have really good confidence in. But also, some things to point out are, first, the athletes who come to World Games
are the healthiest of our athletes. Not only because they competed and qualified to get to the World Games, and so they're probably at a higher level of competition and a higher level of fitness, but also because they can be away from home for like 2 or 3 weeks. And that means they have good medication management, they don't have a lot of unstable health conditions, probably they have fewer behavioral issues, which of course isn't directly health related, but it is when you walk into a doctor's office. So these are healthy athletes. And if you look at those data, and then you think that 45% of them have obvious untreated tooth decay, we don't do x-rays. It's just looking in the mouth. And that's just really quite horrifying to us. You look at the data on bone density, and the average is 25. We're already seeing risk for osteopenia and osteoporosis in our athletes. And they often look very healthy because they're young, and you just don't see it, you don't test for it, you don't know it until they come to a healthy athletes event.
That's kind of quick, but this is one that you may want, trainees you may want to use. You may not use the video depending on what kind of
AV is available to you, but when you bring in people who are just volunteering for the day, and you want to give them an overview of how to work with a patient with intellectual disability, the lessons in this video are very common sense, but it's helpful to say them.
There's something the ID community jokingly refers to as the 10 Commandments of communicating with a person with disabilities. It's common courtesy regarding how to treat patients with disabilities when they come to visit you.
Speak to me, not my mom. Shake my hand, depend on me.
Identify yourself when you're meeting a person who is blind.
If you offer to help me, wait until I say yes.
Treat adults as adults.
Don't lean or hang over to somebody's wheelchair.
Listen carefully to people who have trouble speaking and let them finish.
Talk to a person at eye level with a person in a wheelchair.
Tap a person who is deaf on the shoulder.
Relax. Don't be embarrassed. It doesn't matter what to say to us.
I think as you go forward in your experience with Healthy Athletes and Special Olympics, it'll feel sometimes like a very mixed set of emotions. I think you will have days where you just shake your head and are really depressed because you have athletes who are 25 or 30 or 40 or 50 years old who come in with conditions that are causing them pain, that are causing kind of negative impacts on their lives in a range of ways that could have been prevented, that could have been treated, that haven't been diagnosed, that haven't been attended to. And they've just been functioning like that, and it's really quite heartbreaking. On the other side of that, I hope that you'll feel pretty good about your involvement in changing that and in making a difference and in helping identify problems, in some cases helping to address the problems, and certainly educating the athletes and their families so that they can do something about problems that maybe nobody even knew about. This is Christina O'Neill. She's from Special Olympics Missouri. She's one of our Sargent Shriver International Global Messengers, which means she's a global spokesperson for Special Olympics and travels around the world on our behalf. She's also a swimmer, and she had both eyeglasses and prescription goggles made for her through Healthy Athletes. It wasn't until, I mean, she was a swimmer, she's accomplished, we love her, she's articulate, she speaks on our behalf all over the world. It wasn't until she went to Opening Eyes and had her vision checked, and they gave her these new glasses, and she jumped in the pool, and the first thing she did was go to the bottom and stay under the water for a while, and everybody started to get a little bit worried. And when she came back up, they said, "Christina, what are you doing?" And she said, "Well, there's this black line on the bottom of the pool." She'd never seen it before, and nobody knew. This is Roy Lehman. Special Olympics Wisconsin went an extra mile. A lot of programs, and many of your programs will do different versions, go an extra mile in some aspect of Healthy Athletes. And one of the things that Wisconsin has done, actually Wisconsin does a lot of things really well, but one of the things that they did recently is partner with Mission of Mercy in the state of Wisconsin so that athletes who came out of Special Smiles with urgent care need could be routed into the state's Mission of Mercy event without waiting in line extensively and to get the care that they needed. And so this is Roy Lehman. He had, I'm not a dentist, so I may not say it right, but he had such bad dental decay that they took out about 6 teeth, I think, in the front of his mouth and put in is it a partial denture? Is that what you call it? That's him post-treatment. After about 5 hours of yucking it up with the dentist, he walked away happy. He had been in pain for a couple of years before he went into this event. This is Victor Fesinachi. He's from Nigeria. Victor is one of the first recipients of a hearing aid provided at no charge to Victor. How many an audiologist who knows the average price of a hearing aid? A pair.
Probably for a pair.
Yeah.
$3,000.
Yeah, that's what they quoted us too. So, $3,000 hearing aid pair that he got at the World Games in Athens, part of a new partnership between Special Olympics and FONAC and its corporate foundation, which is here the World Foundation. And for a lot of cases, we're fitting the hearing aids of the athletes who competed in Athens after they go back home, so they have a connection with a local care provider for that follow-up care that you need with hearing aids so they can get them adjusted. For athletes who didn't live near a place where they could get the care, they got fitted at the games. I know that some of you lost revenue, the trainees, by being here. I know that some of you took vacation time or leave time. Certainly you're giving up time with your family and weekend time. But even more than that, you're making a commitment over the next few years to really make a difference in the lives of our athletes. But it involves partnership building and recruiting and organizing and some logistics, and you should, if there's not already a team in place to support you, you will create one so that you don't have to put it all right here. But it is a lot of work, and I just want to make sure you know how much we are aware of that and appreciate what you've committed to doing. So thank you very much. I just want to finish with one letter that we got recently from a volunteer, and so I'm ending with something that might be sort of like what your perspective could be at the end of this weekend. We'll see. She was a nursing student at Kaohsiung Medical University in China, in Taiwan. And after her experience, she had no experience previously with people with intellectual disability or with Special Olympics, but after she went home, she was just so moved by the experience that she wrote us a letter. And she's, of course, not a native English speaker. The English is a little bit rough, so bear with me on that. And I'm just going to read one paragraph out of her letter. Patience, perseverance, caring, and empathy were the key points that would support us to get along with these special students, I thought to myself in the beginning. But once we really had contact and communication with them, somehow it seemed that we weren't the ones who gave, but we received instead. We saw the perseverance and patience they had to cope with things that seemed foreign and intricate to them, as well as the caring and empathy between the peers. Not until now did we witness the tenacity of them. They desired to lead a normal life as we did, and they craved for dignity as we did. They were special, and yet they were not so special. It was a grace from God that they had such an opportunity to be teachers to us. They taught us something unavailable to us in our school. So I hope that you feel some part of that. I hope that the people you recruit to volunteer back in your communities feel some part of this, because I always think it's more important for the people who volunteer to walk away feeling like they're getting more than they're giving. From a business perspective, that's a very good strategy. But I thought that she says it in a way that is probably more powerful than I could. So I will end with that. So thank you for listening to me.